arteriography, some of the vasculature about the shoulder. The subclavian artery branches off the aorta on the left and the brachiocephalic trunk on the right. The medial aspect of this vessel is retroclavicular, whereas the lateral aspect is subclavicular. The vessel forms an arch. The vertex of this arch is between the scalene muscles. The subclavian artery is divided into three portions: prescalene, interscalene, and postscalene. The prescalene portion ascends to the vertex located at the interscalenic triangle, the space between the middle and anterior scalene muscles. It lies on the pleura of the lung apex and the sulcus for the subclavian artery on the superior aspect of the first rib. At this position, the arch turns and is directed caudally beneath the clavicle, where it is called the axillary artery. The axillary artery is in contact with the external intercostal muscle of the first intercostal space, the first digitation of the serratus anterior and the posterior wall of the axilla. It continues to the inferior border of the pectoralis major muscle. All the branches of this artery originate from its antero-inferior surface. These branches are described here according to their location on the medial, posterior, or lateral aspect of the pectoralis minor muscle. Medial to the pectoralis minor. Superior thoracic artery. This small vessel originates from behind the subclavian muscle and then descends along the anterior thoracic wall, piercing the clavipectoral fascia. Its muscular branches supply the subclavius muscle, both the pectoralis muscles, and the superior portion of the serratus anterior. The artery then continues along the first two intercostal spaces, and some branches may reach the skin. In women, this vessel supplies the mammary glands through the lateral mammary branches. It anastomoses with the various vessels that reach the anterior thoracic wall. Thoracoacromial artery. This artery originates at the level where the axillary artery reaches the upper edge of the pectoralis minor. After a short lateral cranial course, the thoracoacromial artery pierces the clavipectoral fascia and sends several branches in all directions. The pectoral branches descend between the pectoralis muscles, the superior aspect of the serratus anterior, and the anterior aspect of the thorax. The acromial branch, directed laterally parallel to the clavicle and over the coracoid process to the acromion, covered by the deltoid muscle. The deltoid branch, oriented laterally, which follows the course of the cephalic vein in the deltopectoral interval and sends muscular branches for the deltoid and the pectoralis muscles. The small clavicular branch extends toward the subclavius muscle, the clavicle, and the sternoclavicular joint. Branches posterior to the pectoralis minor. When the axillary artery passes behind the pectoralis minor, it is located behind the axillary fat between the cords of the brachial plexus. These fascicles are called lateral, posterior, and medial cords based on their relationship to the axillary artery. Lateral thoracic artery. It originates behind the pectoralis minor muscle beneath its inferior edge and sends muscular branches to the pectoralis muscles. It descends to the fifth or sixth intercostal space where it lies close to the long thoracic nerve between the pectoralis minor and the serratus anterior. Subscapular artery. This artery originates at the lateral edge of the subscapularis muscle, although in some individuals it originates from a common trunk with the humeral circumflex artery. After a short course, it continues in front of the subscapularis muscle, sending muscular branches and additional branches to the adjacent fat and lymph nodes. The subscapular artery finally divides into two terminal branches, the thoracodorsal artery and the circumflex scapular artery. The thoracodorsal artery follows the course of the subscapular artery in a caudal direction behind the posterior axillary fold. It joins the thoracodorsal nerve along the lateral edge of the scapula, extending to and supplying the teres major, the latissimus dorsi, and the intercostal muscles, and the serratus anterior. It anastomoses with intercostal branches and the dorsal scapular artery to reach the skin on the lateral aspect of the thorax. The circumflex scapular artery follows a posteriorly directed arch to the internal aspect of the axilla and sends 3 branches. Branches lateral to the pectoralis minor. The lateral portion of the axillary artery lies close to the surgical neck of the humerus and sends branches, the circumflex arteries, to surround it. In some individuals, these arteries arise from a common trunk. More often, they originate from separate arteries. The anterior circumflex humeral artery. In some individuals, this artery divides into several branches. The larger vessel courses over the latissimus dorsi and surrounds the humeral neck very close to the bone beneath the coracobrachialis and the short head of the biceps. As this vessel turns laterally, it courses between the tendon of the long head of the biceps brachii. The ascending branches follow the intertubercular groove to supply the intertubercular synovial groove and the periosteum until they reach the articular capsule of the glenohumeral joint. The descending branches are directed to the deltoid and anastomose with the posterior circumflex humeral artery. The posterior circumflex humeral artery. This artery arises at approximately the same level as the subscapular artery on the posterior wall of the axillary artery. With the axillary nerve, it forms a posteriorly directed arch around the humeral neck. This branch crosses the quadrangular space close to the humerus. In this region, it sends branches to the muscles that border this space, as well as to the teres minor and major, triceps, and latissimus dorsi. Finally, this vessel sends branches to the deltoid and the glenohumeral articular capsule. In most individuals, it anastomoses with the anterior circumflex artery and the acromiothoracic artery. But in some, it anastomoses with the deltoid branches of the deep brachial artery.